President Trump had this to say about Medicaid. Take a listen.
We should give our state governors the resources and flexibility they need with Medicaid to make sure no one is left out.
No one is left out, but there are 4 Republican governors, as I'm sure you know, Kasich, Snyder, Sandoval, and Hutchinson, that say that this bill does not live up to the principles enumerated by President Trump. They wrote to the Republican congressional leaders saying, quote, the current version of the House bill does not meet this test. It provides almost no new flexibility for states, does not ensure the resources necessary to make sure no one is left out, and shifts significant new costs to states. So, Mr. Secretary, these are Republican governors that are objecting to your plan, saying that you're going to be leaving people out. It's not just a question of access. A lot of Americans are going to be left behind because the Medicaid expansion will be ended and there are fewer resources that will go their way. What is your message to these Republican governors?
Well, I hate to sound like a broken record, but what they're looking at is not the plan. What they're looking at is this first piece of legislation. And as you and they know, you can't put the kind of flexibility that's necessary for them to be able to fashion their program for their vulnerable population in the way that they see fit in the first piece of legislation, which is why it's this 3-phase or 3-part or 3 legs of a stool plan. And I've talked to countless governors, including the 4 that signed that letter, and talked about the kind of flexibility that they want and they desire to make certain that they're able to put in place a plan that cares for their vulnerable population. They're incredibly supportive of the kinds of things that we're talking about in that administrative phase and in the 3rd phase, where we actually are able to get to some of the insurance reforms that you can't get to because of the rules of the Senate in the first. At the end of the day, this isn't about just the process that we go through here in Washington. This is about whether or not the American people are going to get the health care that they need.